Is Albert Diaz. I'm an advanced nurse practitioner student, and I will be performing my neurological and abdominal assessment. Hello.
Hello.
My name is Albert Diaz. I'm a nurse practitioner student. I'll be performing an abdominal and neurological assessment on you. Do I have permission?
Yeah.
Okay. I'm going to be inspecting your abdomen, and then not only that, but I'm going to be touching your face and all that, and also your lower extremities, just to kind of make you aware. Okay. His general appearance overall, he appears. How old are you, sir? 26-year-old healthy male, alert and oriented times 4. Have you had any surgeries in the past?
Right hand surgery.
Okay, perfect. I'm going to take a look at his nail beds just real quick, as these can be indicative of any hepatic issues. No clubbing of the fingers, nothing like that. Skin appears nice, clean, dry, and intact. If you could do me a favor, if you could lift up your stomach, your shirt there, so I can inspect your abdomen. No scars noted, pretty symmetrical. And I'm going to look from the other side as well. So we're going to inspect first, auscultate next. Okay, so I'm going to go ahead and have you lie back. I'll assist you to lie back. Go ahead. Perfect. I'm going to go ahead and listen to his abdomen. First in the right upper quadrant. Vowel sounds are normal active. Perfect. I'm going to start with some light palpitation. I'm not going to push too hard. I'm just going to press across all 9 regions. And you let me know if there's any pain or anything. No. Nothing. Now this palpation is going to be a little bit deeper. I'm going to press a little bit harder. Feeling for any masses, any abnormalities, any enlargement of anything, and none are noted. Okay. And now what I'm going to do is I'm going to do the Bloomberg test. I'm going to push a little bit of pressure, nothing too hard though, okay? And you tell me if you feel any pain. No?
No.
Nothing. Good. And then I'm going to do the Murphy test. I'm gonna put a little bit of pressure, checking for the gallbladder. I'm gonna have you take a nice deep breath and let go. Any pain?
No.
Nothing. Okay. Next, I'm gonna check McBurdy's point. I'm gonna check between the umbilicus and the iliac crest. I'm gonna do one more time. I'm gonna press and let go. Any rebound tenderness? No rebound tenderness. No ascites has been noted. And then I'm going to do the percussion. I'm going to just percuss across, listening for tympany or any dullness. None noted. Everything sounds pretty equal. Next, I'm going to check the psoas. What I'm going to have you do is I want you to lift here. Just go ahead and just lift a push against my hand here, and you'll be looking for any pain in the abdomen. Nothing there. Go ahead and straighten out your leg, and then lift again there. Any pain there? No. Next, I'm going to have you flex your knees. This is the obturator, and I'm going to have you just relax, and I'm going to flex in, and I'm going to flex out. No pain. Nothing. And what we'd look for is any signs of peritonitis. Okay. I'm going to have you sit up real quick. I'm going to check the costal vertebral reflex here. And I'm just going to place my hand on the costal vertebral angle. Any pain?
No.
No. The next part of my assessment will be the cranial nerves. I'm going to start with cranial nerve number 1, which is the olfactory. If you'll close your eyes for me, I'm going to put something under your nose. Just tell me what you smell.
Mint.
Okay, perfect. Cranial nerve 2 is going to be the optic. I'm going to have you read. I'm going to have you hold this at 6 feet. I'm going to have you read this. If you can, tell me which line you can read.
2020.
Tell me, go ahead and read those lines.
LTFPH.
Perfect. Cover your left eye. Once again, read that line.
LTFPH.
Cover your right eye.
LTFPH.
Perfect. The next cranial nerve I'm going to check will be the optic nerve, the olfactory, the trochlear nerve and the abducens. So what I'm going to have you do is I'm going to check your visual acuity, okay? What I want you to do is cover your left eye, and I'm sorry, cover your left eye, and I'm going to put a number up. Just look straight here at my nose. I'm going to put up a number here. Tell me what number you see.
3,
And once again up here.
2,
And cover your other side, and tell me what you see.
2,
And what do you see here?
3.
Perfect. And go ahead and keep it covered. Keep looking at my nose. I'm going to tell me when you start seeing my fingers wiggle.
I see.
Perfect. And here,
Right now.
and then the other side.
See 'em.
Okay.
See 'em.
Perfect. Okay. Now I'm going to have you. I'm going to just look at the accommodation of your eyes. I'm going to look. I want to have just look it up straight ahead there. I'm just going to look for your eyes to be equal, round, and reactive. Good. 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 And perfect. What I want you to do is I want you to look at me here, and then I'm going to have you just follow the tip of my finger and just follow just with your eyes. Good. I'm checking all 6 fields of vision. Good. 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 And good. Now this is the worst one. I'm going to bring it close to your nose just to check for you to follow it all the way, kind of make you cross-eyed, and good. Alrighty, perfect. Since we've checked 3, 4, and 6, the next one's going to be the trigeminal nerve. I'm going to have you bite down as hard as you can, and I'm going to feel right there, and I feel that. Go ahead and release, and open your mouth, and then bite down again. Good trigeminal nerve reflex. And I'm gonna perform some touches on your face here, okay? And I'm just gonna want you to tell me if you feel soft or, and it's just gonna be a dull sensation, okay? Go ahead and close your eyes. Tell me if you feel it.
I feel it.
Okay.
Feel it.
Okay.
Feel it.
Good. Perfect. That's 6. For 7, go ahead and open your eyes. I'm going to check your facial cranial nerve. I want you to puff out your cheeks, and then go ahead and let it release, and then purse your lips, and then close your eyes. Close them tight, tight, tight. Don't let me open them. Good. Okay, good. Next will be your cranial nerve number 8. I'm going to check your hearing, okay? Normally what I would use, I'm going to use a tuning fork. I have a different type of tuning fork. I'm going to place it by your ear. I want you to tell me when it stops ringing, okay? Okay, good. And once again on this side. Good. Good. Next one I'm going to have you do is I'm going to have you cover your own ear on this side. I'm going to whisper something into your ear, and you repeat what I said, okay?
30 degrees.
Cover the other side.
28.
Excellent. That is number 8. Number 9 and 10 are, have you had any trouble swallowing, anything like that? I want you to do me a favor, take a big, big gulp. I'm just going to feel here. Take a big gulp. Good. Excellent. And then normally what I would do is I'd have them sip a little bit of water, and you haven't had any trouble swallowing.
No.
I would check for his ability to swallow, and that would be 9 and 10. As far as 11, I'm going to check your strength here. Push up against my shoulders. Good. And then push against my hand. And then the other way. Now turn your head that way. There you go. And same here. Good. And then the last thing I want for number 12, I want you to open your mouth, stick out your tongue, and then to the roof, and then down, and to the side, and to the side. Go and close your mouth, push your tongue against here, and then here as well. Good. And stop. The next portion of my test will be the neurological system test. The first one I'm going to start with is the Romberg test. If I could have you stand up, Mr. Gonzalez. Go ahead and close your eyes. Just hold yourself nice and still. And you always do this just to provide safety in case they start to sway. You can open your eyes, sir. The next thing I'm going to have you do is called the pronator test. I'm going to have you close your eyes, and all I want you to do is go from here to here to here to here. I'm going to do it for 10 seconds, okay? Go ahead. Perfect. You can open your eyes. What we're looking for is any differentiation between the two arms, if any of them are drooping or not. obviously his are intact. The next thing I want to do, I'm going to have you follow me. We're going to take a few steps down the hallway. I just want to observe your gait. If you could take 5 steps that way. And what I'm looking for is a nice even sway. Shift over from back. Come on back. No unsteady gait, pretty balanced. Next thing I want you to do is walk on your heels. So I want you to walk just 5 steps that way on your heels. 5. Okay, and back on your heels. Good. And then what I want you to do is on your toes this time. 1, 2, and pretty even gait. And then come on back. 1, 2, 4, 5. Perfect. And then we'll come right back into the room here. Go ahead and have a seat for me. The next thing we're going to do is we're going to work on the nose to finger test. Okay, what I want you to do is touch your nose and then touch my finger and then touch your nose, touch my finger. Good. Touch your nose, touch my finger, touch your nose, touch my finger. Good. Okay, the last part of this is going to be the reflexes. I'm going to check your reflexes. Okay, I'm going to check your brachioradialis first. That's just going to entail me tapping your forearm. What I want you to do is just go ahead and place it there. I'm going to find the brachial notch, and then I'm going to tap. Good. And then here as well. Good. The next one is the tricep. I'm going to lift your arm. I'll assist you. Just kind of relax your hand there. I'm going to find the tendon, and then good. And then the same thing with this one. Good. And then we'll check the patellar reflex. Good. And then we'll check, while we're here, we'll do the Achilles. Good. And then the next one here, just relax your leg. Good. And then your Achilles. Good. And that concludes my assessment. Thank you.